Hello, and thank you for joining. I would like to take a few moments during this first podcast to give you a little background about myself and my passion for mental health and addiction and what led me to creating this podcast. So I've always had a heart for caring for others. I believe my spark was ignited by the love and compassion that was poured into me when I was a child, from my grandmother to my mother to my aunts to my uncles. It fostered resilience and healthy coping skills, which are both essential for stable mental health. So I entered the world of nursing thinking that is where my segue would be to helping the most people, having the greatest impact on people. So in 2011, I entered the world of nursing as a registered nurse. Well, actually, let me back up a bit. My niche, my aha moment, identifying what area of nursing I wanted to work in, actually took place during nursing school when I was completing a rotation on an inpatient behavioral health unit. On this unit, we provided care for patients who were undergoing various mental health issues, ranging from depression, anxiety, bipolar, schizophrenia, posttraumatic stress disorder. So any type of mental health issue, eating disorders. We also provided care for patients who were dealing with a substance misuse or chemical dependency. So it could have been they were struggling with opiate addiction. They were struggling with methamphetamine, crack cocaine. So any type of illicit substances we were treating, as well as chemical dependency. Now, once my seed was planted and I knew mental health is where I wanted to work to be of the greatest service, I fostered its growth by seeking an environment that would allow me to expand my knowledge. I was blessed and honored to join the staff at the Department of Veteran Affairs for many years. During this time frame, I was afforded the opportunity to learn from some phenomenal psychiatrists, psychologists, and nurses. I would be remiss if I didn't give thanks to Dr. Lee Gaines, a psychiatrist, and Dr. Danny Hall, a psychologist. Both of them allowed me to tap into their knowledge and skill set with treating veterans with dual diagnosis and mental health disorders and or a chemical or substance dependency. After I realized I wanted to have a greater impact in treating my patients, I decided that I was going to return to school, earn my degree as a nurse practitioner, in which a master's degree is required. During this time of my internships and my practicums to become a nurse practitioner, I received instruction and mentorship from some amazing psychiatrists, nurse practitioners, psychologists, social workers. But I must give a heartfelt and sincere thank you to a psychologist, Dr. Rick Monroe, with the Department of Veteran Affairs. Dr. Monroe coached, mentored me, provided me with evidence-based therapies specific to the veteran population, which has stuck with me and continued to help me throughout my journey. I have a lot of materials he provided me. Just if I have a question, I can always reach out to him. He's just an amazing mentor. My education and pharmacological treatment, that's medication treatment, for illicit substances and chemical dependency, those were cultivated and continues to grow by Dr. Roberto Soria, who is an outstanding provider in addictions and mental health. Teacher, provider, he's just amazing. So after I received my advanced practice nursing degree, nurse practitioner, I couldn't stop there. I decided and wanted to earn my doctoral degree, which allowed me to expand my knowledge by conducting rigorous research and implementing an evidence-based project to help improve patient care and patient outcomes. Now that I've shared a little bit about my background, let's get into today's podcast. So in today's podcast, I will focus on post-traumatic stress disorder, which you'll often hear referred to as PTSD, or in the past, it was referred to, for an example, as shell shock, which is a name that was attached to veterans returning home from war. This podcast, I would like to say, though, is for informational purposes only. It's not intended to provide a diagnosis. is to provide the signs and symptoms and some treatment modalities that can assist with managing these symptoms for those who may be suffering some of these symptoms and may seek additional assistance from a licensed mental health professional. So until then, this is just some background information. So I selected post-traumatic stress disorder because a large portion of the patients that I personally treat, they have a clinical diagnosis of post-traumatic stress disorder, and it's also a disorder in which I personally can identify with. Post-traumatic stress disorder is one of the most common disorders, treated and untreated, because there are many people who are suffering in silence. As the name and the disorder itself, post-traumatic stress disorder, it happens post, so after someone has witnessed or experienced a traumatic event. I'll give you some examples of a traumatizing event that can trigger post-traumatic stress disorder. You can witness or commit a murder. You can witness or be a part of a sexual assault, physical violence, vehicle accident, a really traumatic vehicle accident, a war-related experience. So these are some examples that you may see in someone with post-traumatic stress disorder. I will provide a personal example. So in 2018, I personally had an unexpected heart emergency, which required me to undergo open heart surgery. And I developed a chronic heart condition. I was doing so well for about 4 years after my surgery. Then unfortunately, I began developing complications and was hospitalized several times. Fast forward to October of 2023, this past October, my heart condition was further declining right before my eyes. My family, my friends, my coworkers, they could see my decline and were encouraging me constantly to seek medical attention. However, I was resistant to seeking medical attention because I associated seeking medical attention to needing surgery or extensive hospital stay. By giving in to this fear, my health further declined, requiring me to have a second open heart surgery just this past March, in March of 2024. I'm elated though, however, to share today my heart has been repaired and I am now healthy. I share this personal experience in hopes that my transparency can help someone identify a trauma that may be holding them back from living their best life. So post-traumatic stress disorder occurs when the natural process of coping with a traumatic experience lingers for months or sometimes years. The symptoms must be longer than a month, though, for it to be post-traumatic stress disorder. Many people begin to develop symptoms within the first 3 months of their trauma. It's important to note that not everyone who experiences a trauma or a traumatic event will develop post-traumatic stress disorder. Now let's discuss some common signs and symptoms you may see in someone suffering from post-traumatic stress disorder. Ruminating thoughts. This is just repetitive thoughts, negative thoughts that was associated with your trauma. Flashbacks. This is a clear memory, a clear, vivid memory of the trauma. Nightmares, a frightening or unpleasant dream. Insomnia, the inability to fall asleep or stay asleep. Isolation. Some people isolate from people, places, things that remind them of the event. So they stay to themselves. They stay in their home. They stay in their room. So that's isolation. Or again, isolating yourself from certain people, places, or things, or smells. So it could be, nope, I'm not going into the ice cream parlor. That smell is going to trigger something. So it could be things like that. Anxiety. Feeling dread, feeling doom, feeling fear, depression, persistent sadness, easily startled, always on guard. So these are some examples of some of the signs and symptoms to be cautious of. I'd like to provide a few more exampos. I'm going to give you a few more examples of something you may see someone suffering from post-traumatic stress disorder. For example, they may associate the sound of a car backfiring or a firecracker to a gunshot wound or a war experience and become easily startled, clam up, and begin to immediately seek shelter. They may associate the sound of a fire truck or an ambulance to a house fire, to a vehicle accident that required them to be taken to the hospital in an emergency vehicle. So these sounds can trigger a flashback or a ruminating thought. Hearing or seeing about a domestic violence or physical assault. So someone telling you about an assault or you seeing it on the news, these can trigger flashbacks. These can trigger ruminating thoughts. It can trigger a nightmare. But the good news is there are safe and effective treatment options available to help manage these symptoms, such as engaging in a hobby, doing things you enjoy. They serve as a healthy distraction, whether it's line dancing, painting, journaling. Anything that you find as a great hobby can be a distraction. As a positive hobby can be a good distraction. Journaling. This is a great way to get your feelings down on paper and help you process through your emotions. Mindfulness and meditation. This simply requires sitting in a quiet space, focusing on what's going around you at that very moment. Deep breathing. This is very helpful as it helps to decrease heart rate and decrease your blood pressure and improve your oxygen consumption. So deep breathing is very effective. Listening to music. Listening to music helps because it helps reduce the cortisol hormone, which is increased during stressful situations. Now, with music, there's a caveat because listening to music can also be a trigger. For example, if a certain song was playing during the traumatic event, whenever you hear that song, it may trigger a flashback or a ruminating thought. So that can be a tricky one if music was involved in the trauma. Prayer. This is essential for people who have a spiritual background. Prayer can be very effective. Exercising, yoga, they help produce the feel-good endorphins in our brain by increasing the blood flow to the brain. So exercise and yoga are amazing. And then there's psychotherapy. Psychotherapy is talk therapy. So this is where you see a psychologist, you see a licensed mental health therapist, you can see a social worker. Those who are qualified to provide therapy, mental health nurse practitioners. They will provide evidence-based therapy, talk therapy, exercises to help you process through your emotions effectively. Then there's pharmacological treatment. This is simply medication. There are a lot of medications that are safe, a lot of safe medications that can help manage signs and symptoms. Help manage the symptoms that's associated with post-traumatic stress disorder if one field therapy is not effective. Or, in my opinion, I believe they go hand in hand. If you're going to take medication to treat your post-traumatic stress disorder, you should also be receiving psychological therapy, which is the talk therapy. I believe these two go hand in hand. Now, if you or someone you know have experienced or witnessed a trauma associated with post-traumatic stress disorder signs and symptoms that I've discussed, I would encourage you to reach out to a licensed mental health professional to undergo a full assessment and evaluation for post-traumatic stress disorder. At this time, a treatment plan can be developed to help manage symptoms and, most importantly, improve quality of life. Thank you for listening. Please, if you like this podcast and found it insightful, please like and subscribe to my channel. Have a great day, and thank you for listening.